The meeting is called to order. We will dispense with the reading of the minutes as they've already been approved. Okay, let's go right to the resolutions. And John, with regard to KeyBank, the National Association loan.
Sure. So as I've mentioned the last few meetings, we've been exploring all opportunities for additional funding relief, specifically on the cash flow side. This resolution in front of you essentially provides us authorization to pursue the approval that we have recently received from KeyBank to undertake the Paycheck Protection Program loan, which we were approved for within the last couple of weeks. It's a $10 million loan program that we were eligible for. It starts as a 5-year term, 1% loan, which has the potential for 100% forgiveness, but only if you meet certain requirements and throughout the payroll protection program period, which has just been extended out to the end of the year. So essentially, it's a fairly simple resolution, and I'll ask Tony Colucci if you wanted to add anything to what I've outlined as needed for this resolution.
Only that in addition to granting the corporation the authority to receive the funds, we've taken certain steps before this meeting, and the resolution ratifies those steps as well.
Thanks, Tony.
Okay, anything further, John or Tony?
No.
Will someone make the motion, please?
This is Jen. I'll be happy to make that motion.
Sharon will second.
Sharon Hansen seconds. Is there any further discussion or question for John and or Tony about this resolution? If there are none, all in favor, please signify by saying aye.
Aye.
I don't know what that bell means at the end, but okay. And opposed? That motion carries unanimously. Thank you. And I'm not sure, Dr. Flynn on the call? Dr. Murray, do you want to do the medical staff dental meeting?
Yes, I'll be glad to. You have the Credentials Committee minutes from the June 4th meeting. And during that meeting, the following were recommended for approval: 3 physicians, 4 physician assistants, 1 nurse practitioner, and 4 CRNAs. It's a time where we onboard a lot of people with July upcoming. Otherwise, the rest of the minutes was just routine business. No significant resignations to report. So I would ask for the approval of the Credentials Committee meetings as approved by the medical exec.
Thank you, Dr. Murray. Motion's been made. Is there a second?
Second. This is Jen.
Second, Jen Persico. Further discussion? All in favor of approving the motion as presented by Dr. Murray, please signify by saying aye.
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 And opposed? Thank you all very much. Thank you, Dr. Murray and Tom Quattrochi.
Okay, thank you, John. I'm going to share my screen here. 1 second. Sorry. All right, can everybody see that?
No?
No.
No.
Nope.
Thought I shared my screen.
Nope.
Hang on a second. Oh, it says sketch. Here we go. Hang on a second. Now I did it. There we go.
There we go.
Oh,
Got it.
now
Okay.
we're good.
We're
Well
good.
done, Tom.
You're a techie now.
Yes, so. All right. First of all, I want to thank the board members that were able to join us in ECMC's show of solidarity against racism and injustice. I know that John Dandies was there, and Mike Seaman, and Gino Russi, and Dr. Graham. I just want to thank you for, and the entire board, thank you for your support. Andy's going to talk a little bit about the efforts the hospital has been engaged in to continue to take this moment in time and advance our solidarity against racism and injustice. And Cindy Bass, as you know, is the head of our diversity and inclusion, has been reporting to my office for a year now. She happens to be out on family leave, unfortunately. So administratively, I've asked Andy to lead this effort. So Andy, if you could just inform the board as to the efforts that we've been engaged in and the committee for diversity and inclusion.
Yeah, happy to do that, Tom. And I want to thank the board for your support of this program. Over, I guess, the last couple weeks, we have re-engaged our diversity council. It was a council made up of about 18 to 20 plus people, wide variety of individuals. We have some doctors on that council, nurses, non-clinical people. We've got very diverse group, and certainly at the right time, I want to thank them for their efforts. Just kind of level set, our diversity and inclusion program really falls in 4 pillars, which was the patient experience and quality outcomes, our workforce development initiatives, community engagement, and organizational cultural proficiency. And so as we have, as an institution and like the nation, started to have the conversation on race, there were some things that working with the Diversity Council that we thought we should probably start doing first. So a couple of steps that we will take initially will be to have Tom and I will provide a webinar to kind of re-tee things for us as a diversity organization that is taking us very seriously. We will also begin monthly webinars that will focus on training for our team around things like unconscious bias and cultural competency. We are going to leverage the Schwartz rounds that have been very successful here. We will obviously over the next, for the month of July, the Committee on Schwartz rounds has developed a module that they're going to go through the hospital and do each week. Obviously, we have to do it each week for social distancing. We used to have Schwartz round. We used to have 100 plus people in a room. Now we will break that down to about 25.
Could you just, for some of the board members who may not know what Schwartz rounds are, could you just describe?
Yes. So Schwartz rounds are led by, actually in the past with Dr. Fatima and Dr. Keenan. Dr. Keenan has certainly continued those Schwartz rounds along with Dr. Vernon Clifton. They focus on a variety of topics, largely due to wellness or various potential topics that are relevant. And it's also been a great time for our hospital to come together, talk about various different issues. So we thought the Schwartz rounds was a great forum to do that. And that committee was gracious enough to start outlining a program around that. The Diversity Council, which has, like I said, about 20 plus people, will go through some training over the next couple of weeks. And they will be used as ambassadors to have small group discussions with our staff throughout the organization. Obviously, we want to do that because of social distancing, but also that, have conversations of this magnitude are very important, and that they need to, one, be trained and know what to say and create a safe haven space. And so those discussions will start taking place here in July. And then we'll continue to probably have a diversity survey. It's one of the things that the Diversity Council wanted to do. So, we will, continue to report to you the progress that we're making in the organization to educate people on race and other privileges, and to continue to have an organization that spearheading and leading, and we're excited about the opportunity. And I think the work that Cindy had previously done and has set the foundation gives us a great path to go forward.
Okay, thank you, Andy. Any questions from the board or comments?
No, I would just, this is John, I would just add to Andy's report and thank Andy for his leadership in this regard. But part of that training will be for the board as well. So we'll be back in touch with everyone as to what our next steps are with regard to D&I training for all of our board members.
Great. Thank you, John.
Mike Hoffer here.
Yes, Mike.
Andy, great report. I would just like to say, I've been a member of the Human Resources Committee for a number of years now with Bishop Badger, also now chairing the Quality Improvement Committee. And I've been very proud of our diversity. Cindy has been excellent. Prior to her, Janique Curry was excellent in implementing many of the programs that we have. Unfortunately, what we see today is we all have to do better. But your report was excellent, and I'm looking forward to moving forward, and particularly the training for the board members. Great job, Andy. Thanks very much.
Thanks, Mike. Okay. Obviously, since our last board meeting, we had our opening of our KeyBank Trauma and Emergency Department. Again, apologize to the board that we couldn't have everyone there. We had to keep our crowd small. And we, as you can see in the back, we had staff there from the ED, and obviously John represented the board, as well as Elizabeth Gurney from KeyBank, where we cut the ribbon. But we will work to have a celebration this summer for the ED and also Leapfrog A, which we, as you know, we accomplished. Want to give the board an update on COVID situation, number of patients. I should mention also, by the way, in the last slide, I'm going to have Karen give an update on the ED towards the end of this presentation and how things have been going. We've had 216 COVID patients. Average length of stay has been about 16 days. Patients requiring care and event has been 59. Our antibody testing, we've had 106 people out of 1,905, so about 5.6%. We've had about 17,148 tests that we've done, COVID tests to date. Just so you know where we are today, as we sit here, we had 7 COVID patients in-house, 3 whom are vented, and 0 patients under investigation. So again, clearly towards the bottom half of this curve, and hopefully this fall we will not have another one. Want to congratulate the MICU, who again received the Silver Beacon Award for Excellence. This is a national program to recognize intensive care. We are one of 2 in the area and only 16 across New York State. So it's a very prestigious award, and just congratulations to the MICU for receiving this award. Another accomplishment, May of 2020, we had 0 CLABSIs and 0 CLAUDIs. So back to our goal of 0 harm and high reliability. That's an unbelievable accomplishment. So congratulations to the clinical staff for that. We have the Commission on Accreditation of Rehabilitation Facilities survey coming up. It's better known as CARF. That's coming up here this week. We actually have the visit virtually this Thursday and Friday. So we're preparing for that. And again, another national accreditation for rehabilitation. And then third, our burn unit is going to be submitting for Beacon designation also. So I just wanted to let the board know that we're going to be pursuing that. Also this year, as part of our pathway to excellence, we, as you know, we achieved, we've started an annual nursing report for the building, and I just wanted to highlight Karen, her work, and Peter for putting that together. Patient experience, patient visitation, as you know, has been limited. We just started that up. I'll talk about that in operations. Digital health is another piece that we're going to actually put Keith Lukasik in charge of for the organization across all the different platforms. As we talk about strategic planning, I think out of COVID, this is probably, from an operational standpoint, the most marked that we've seen a change in, and that people are really becoming obviously more comfortable with digital health, and we want to be a leader in that space. Patient experience scores continue to be great, again, especially compared to our benchmark. So just congratulations to the nurses and doctors and the whole team for the great work they're doing. Under culture, we're continuing to communicate with the entire building regarding kind of what's going on with regard to COVID-19. I'm continuing a video message. I'm not doing it weekly anymore, but continuing to do that because I received a lot of positive feedback from staff that they appreciated the communication. Karen's continuing to do nursing town halls with the executives. We have WebExes from behavioral health, stress reduction videos. We have an emotional stress survival guide that Dr. Shannon King put up on our intranet for people because obviously this has been a very stressful time and has resources. We also have an employee hotline that employees can use if they need any assistance, as well as our help center, which we have on campus for behavioral health. We passed out scrubs in the first day of the opening of the emergency department, Quebec Emergency Department, and it was obviously very well received. So I just want to let the board know that we did something to celebrate with our team in the ED. Congratulations to Dr. Grimm. Dr. Grimm is going to be receiving this Thursday the Business First Excellence in Healthcare Award. Dr. Grimm, thank you for all your work here at ECMC, and we're proud to have you represent us in this award ceremony, albeit virtually. So, and Mike's impressive. He's using his Zoom skills to do a clap, so it's very impressive. Thank you. Tim Hortons presented a check to us for COVID for $38,000. They did it across their platform, the owners here, and we just are very grateful to them and all the others who contributed to us during the COVID crisis. You may have remembered that we joined with the Buffalo Center for Health Equity to provide them with funding through Millennium to reach out to our community who is underserved and in need of, at the time, I think, access to testing, but more importantly, access to healthcare. So we funded a 12-week emergency outreach program with our district dollars, and which has been very successful. Call centers were established with 15 churches. We had 25,000 telephone calls made and connected with 15,000 community members. And we connected people with behavioral health services, primary care practices, and most importantly, got people testing for COVID-19. As we know, the COVID, because of underlying health conditions, COVID-19 has disproportionately affected minority populations, and this outreach effort really is obviously an effort to help with that situation, but also just in general connecting our community with healthcare services. And they also contacted, they did food delivery to 3,600 families of people who were in need of food and did not have access. We also did funding for testing sites. So we had 10 hospital, community health centers, primary care organizations who had 10 organizations who had 27 sites, and over 20,000 residents were tested for COVID as a result of that initiative. Operations, I talked about patient visitation. We started the new patient visitation that the state has guided us on. We have 4 hours of visitation from 3 to 7, 1 visitor per patient. Right now, visitation remains restricted at Terrace View and all nursing homes across New York State, and no kind of line of sight of when that might change, but I'm sure they're reviewing it as we speak. We've had the second phase of our ED construction started. So that's the ramp coming down and parking lot being built behind it. So we'll be having more work done as we kind of get the front of the ED situated in the back. Lobby food court construction. So, we had obviously a beautiful opening of our new lobby, but we also have a food court, as you know, and we actually renovated the floor there and the ceiling to make it match, and we're continuing work there through September 16th. The window project got put behind a little bit, about 3-4 weeks, so about half of it will be completed by November 1st. We were hoping to have more than half completed by November 1st, and we'll put the ECMC letters back by September 30th. And then finally, we're obviously in search for Anthony DePinto's replacement at Terrace View, who took another opportunity at a large long-term care company. So Andy, do you want to just inform the board where we're at with that search?
Yeah, so we had just started interviews of the team that Pam Lee is leading to source candidates. We will narrow that scope down to 2 to 3 in the next couple weeks, and then hopefully make a decision. So we've had pretty good turnout in terms of candidates, and look forward to going through that process and naming a replacement very soon.
Okay, thank you. And then Karen, can you give an update on the ED and how things have been going? I know we got a little conversation before the meeting started, but if you can just inform the board as to how things are going.
Okay, can you?
Oh, you on mute there, Karen?
The new ED as of today is approximately 21 days. Yesterday, we've seen 217 patients. Over the weekend, we had 19 traumas that we've seen. Our direct bedding remains right now at 80%, which is a large process change and is quite exciting. If you head out into our waiting room, it has minimal people in it. Most people are moved into the care initiation zone. We also, our average daily census thus far, we haven't actually reached a month, is over 180 plus patients. And we've had many days that have been over 190 and 200. So with that, our left without being seen is also dramatically reduced due to our change in our direct bedding. So that is the update. The new ER is a work in progress because it is brand new, it is quite large, and we have subgroups working to help facilitate so we can maximize all of our change. And yes, we are still hiring for our new emergency room.
Okay, thank you, Karen. Any questions from the board around that? We had Mike Manka, I had a conversation with, and he was, telling me that went better than he could have thought, and how impressed he was with all the pre-planning. So thank you to Karen, Andy, Dr. Murray, Jim Turner, as well as everybody on the executive team for all your efforts around the planning, because it obviously paid off, and had the entire ED staff involved, as you know, in the design and the planning before we opened up. So that obviously helped tremendously. So finally, strategic planning. So as we, this is typically the time of year, it's actually a little bit earlier, that we participate in a strategic planning exercise with the board of directors. Obviously COVID put that on hold, but as we come out of COVID, and especially for the next 6 months, and then, obviously into the future, we'd like to get the board together for a strategic planning session. We're thinking of doing that around the next board meeting, so we don't have don't have to do another meeting. We have 3 basic areas that we want to talk to the board about, and that is to strategically look at how COVID-19 affected the organization, affected our strategic plan to date. What is the impact on the organization moving forward with regard to the strategic plan? What things would be accelerated? What things would be decelerated as a result of that? And really look at our short-term priorities and then our overall strategic priorities past the end of the year. Part of that will continue to be financial, as we'll talk about that in a sec. As you know, we've had a significant financial impact to the organization. We're still awaiting on 2 more tranches of funding to see what we'll receive, and received luckily received a significant tranche of funding last round, which was $28 million. but that's only represents about half of our losses to date, that tranche. So we still have a long ways to go. I think we've talked about we're going to have a significant loss this year, probably take us another year to recover, as well as other hospitals in Western New York. But we want to, again, strategically talk to the board about what that means and what we can invest in and what we may need to delay. Let me just kind of show you our weekly outpatient surgeries and where we have been. As you can see, the dip when the order to stop surgery happened. And then when we were approved, this is strictly outpatient surgery, when we were approved out for outpatient. And then we got back to normal volumes with regard to outpatient surgery. With regard to inpatient surgery, again, you can see the stop and then the approval. We have a lot of outpatient surgeries. This does not include this past week, by the way. This is from week 24, but a lot of the outpatient surgeries are already scheduled with which kind of held up some of our inpatient, but those seem to be picking up again this past week. This is, sorry, go ahead, question?
No, this is John, Tom. Just on that last slide, the week 25 for inpatient is back up to 126.
Okay, great. Thank you, John.
Above the red line.
Thank you. Obviously, I don't think this is a surprise to anyone that we had significant decreases in volumes as a result of shutting down surgery and just generally people not coming to the hospital in general. This is indicative of across the community. And that leads us into, if it's okay, John, I'll just have John Swikowski lead right into the financial slides here, unless there's any questions at this point. All right, go ahead, John.
Thanks, Tom. So as Tom mentioned, and as we really discussed over the last couple of months, we anticipated that the losses in a significant way would continue into May. And that's what you're seeing. The last slide that Tom had up was a sea of red, obviously, but more specifically, just to put some numbers around it, with 25% fewer inpatient discharges, 42% fewer inpatient surgeries, and then 61% fewer outpatient surgeries. It really drove the variance this month, which you can see on this slide, drove the revenue variance in particular. So lost revenue of about 21.5 million. We did have operating expenses that exceeded our targets this month during the month of May, and that's really the result of the agreements that we had made with our labor force for enhanced compensation to our staff, specifically and especially those who were caring for the COVID patients on those specific units that we had designated. That was during the month of May. There will be some run out of those costs into June. But again, that's where we really saw the significant impact. And as you can see on this slide, this is only for the month of May. And what we've done here is enhance the presentation a little bit to show you the CARES Act funding relief kind of on a standalone basis, separate and distinct from our operations. And that's how you'll likely see it going forward. It will be a little bit easier to track that for everyone. And as you can see here, we recognized about $21.1 million of financial relief during the month that approximates our lost revenue. So as Tom said, it was great. Very thankful for all that participated and helped in trying to get some additional dollars during the month. But again, not enough. And as you'll see on the next slide, for the year, with our total losses at $62 million from operations for year to date through May, that 21 million that we've recognized, and then the remaining funds that we have not yet recorded based on hitting certain terms and conditions, it's still not enough. So you can see here an income loss from operations with the CARES Act relief is still at a $41 million loss for the year through May. And so what we like to do is continue to kind of track with you some of those hard costs. Of course, this is not everything, but these are primarily the hard costs and revenue loss that compose the impact of COVID-19 just since March 15th. I think, we had some costs prior to that, and we certainly are continuing to add to this number. But as a snapshot for the board through May 31st, you can see here we've lost approximately $35.5 million in revenue, with additional costs of about 11 brings us to about 46.3 million in total costs. And as I mentioned before, and in other meetings, we continually are looking for additional tranches of relief in order to manage our cash flow. And so on the next slide is just a reminder of where we are as a snapshot, of course, at May 31st with about 103 days of cash on hand. That's an all-in number, so that does include those funds that this board has designated for specific things. But nonetheless, we've been really trying to manage and bolster any and all opportunities that we can and have had to help us sustain through this tough period. As you saw, those volume declines so sharp in the months of March and April, starting to really impact the cash coming in the door today, as a matter of fact. So you can see some of the other additional cash initiatives that we had in process, expense management initiatives that we've talked about with the furloughs and layoffs, but other things like working with our insurance plan partners. We have one who's actually extended their advance payments through June 30th. The Medicare loan, which was the bullet above, that's about 37 million. I know I mentioned that in our last meeting, but that's going to start to begin to have to be paid back in July. We are currently working with our elected officials, as well as those in other associations that are helping us within Washington, to really advocate for, on behalf of all hospitals, but especially ours, to give some relief on this Medicare loan, whether it's forgiveness or a longer term payback at a much lower interest rate. No answers on that yet, but that's something that's in hopefully in the works, because again,
John, what's the total amount of that loan again, please?
That is $37 million.
37 million.
Of a loan. It approximates 6 months of our true Medicare fee-for-service revenue. And the payback terms on that for us is essentially a 6-month payback, and it carries an interest rate of 10% currently, as the CARES Act regulations have stated, which is why there's a significant amount of advocacy on behalf of all hospitals to change that.
Thank you.
And then obviously we have grants in process. Tom mentioned a couple tranches of potential federal CARES Act relief dollars that still we don't know about yet. One is a hotspot round 2 that we should know more. We've submitted all of our information and all of the data. We should know more within the next week. But after that round, there still remains about $66 billion in total funding within the CARES Acts that has yet to be dispersed. So we just don't know how they will be dispersing the remaining funds. We talked a little bit about in the very beginning the PPP loan program. So we're very happy that we were able to take advantage of this opportunity to, at the very least, bolster our cash flow while we're working toward meet the metrics on that program throughout the remaining part of the year to attain forgiveness. And then lastly, we are continuing to track any and all costs because they haven't gone away. We continue to build up, try to build up enough stock of personal protective equipment to handle cases today, but it is essentially additional cases that could be coming in the fall. We continue with staffing costs, leave-related costs to this, and so as well as some revenue loss. We haven't quite gotten back to our full potential here. So that leads me to the last bullet, which is in order to file a perfected FEMA claim, at some point in time, all of these costs have been tracked by us, and we'll be filing a claim at some point in time, probably after this kind of initial first wave of the pandemic passes. So probably within the next couple of months. So that's it for my finance report, John. There are any questions?
Thank you, John. Board members, are there any questions for John or Tom relative to the financials, or for that matter, any of Tom's other report?
This is Jen. Hey, John, I know that you've been tracking the COVID costs for a number of reasons that you just went through, but I was wondering, in thinking about our board retreat and our strategic planning, not that I want to add something to your plate, but do you think that we could kind of segregate those costs out so that we can evaluate our budgeting without those additional expenses, with the sincere hope that we will not incur them in the future when we do get together as a board for a retreat?
Yeah, absolutely. We've already started that process. Keith Lukasik has already met with me. We're already talking about that, but we are tracking them as best we can, separated from what we'll call the true operations, Jen, to your point, so that we can make sure we're trying to get as best a run rate as possible. Some of these costs will continue. I think that's important to note, but you know, that's part of what we're going to have to go through as a board and our leadership through this strategic planning process.
Great, thanks. I didn't want to spring that on you right before we all get together.
No, that's okay.
Are we still laying people off or having or accepting furloughs from different employees?
So, as you know, we had a initial layoff, 70 individuals. So that has been completed. Those individuals will not be coming back to the organization probably this year, at the very least. We did do voluntary furloughs. I believe we had 314, if my memory serves me correctly, voluntary furloughs. We're in the process of doing mandatory furloughs / I'll call them layoffs, and I'll talk about why in a second. First of all, AFSCME agreed to do a furlough program for individuals in AFSCME. NISNA has a volunteer program that's in conjunction with the New York State Department of Labor, in which individuals can take a certain percentage of time off in a certain period of time. They volunteer for that. CSCA did not agree to the furlough proposal that we gave them. So what we're going to have to end up doing is doing technically a layoff. It's really a furlough, but technically a layoff, in which we give them 15 days notice, and then we lay off for 30 days, and we can bring people back as we need them or have them laid off for 30 days. We're literally today finalizing those positions based on where we're at budgetarily and financially. So that'll probably, we're hoping that can be the last. Those three I described just a second ago can be the last effort in personnel. However, we are continuing with hiring freeze other than the emergency department, where we need additional staff right now. So that's our efforts to date, and hopefully with the funding we get, we'll be able to, for the rest of the year, not be able to take any other actions. But again, that's, I think, part of the strategic retreat also.
Thank you, Tom.
Yep, thanks, Sharon.
Any other questions? So Jen's question was is a good segue for me to talk a little bit about the where our executive committee has been focused, and that is primarily on two areas. And the first, you would not be shocked, is the ongoing financial challenges that the hospital is facing. And so I just want to recognize Tom and Andy and John specifically for their ongoing management of our budget and the projections and the almost constant meaning daily efforts to minimize our exposure and make sure that we come out of whenever this COVID crisis ends as close to whole as we can possibly be. So that was and continues to be our critical focus, which is then directly related to why our conversation about the strategic planning process is so important. Because as many of you will remember, although it seems a lifetime ago, that we had any number of projects in the queue, if you will, to continue moving forward with the hospital expenditures, particularly things like Kensington Heights and Grider Street. And Tom is going to, the date for the strategic plan, we're going to send a survey around, Tom, correct?
Yeah, we're thinking about trying to do it around the next board meeting again to avoid having another day that you had to come get together, and maybe try to give you some options at times that day, if that's okay. And whether we want to do it noon to 4, or whether we want to do a 3 to 6 or 7 or something like that.
So please, board members, when you get that question or get that email, please respond as quickly as possible, because the conversation around the strategic plan could be one of the most critical ones we've had in a very long time, as we begin to assess where we are and certainly what direction we're going in a positive way. It's not about reinventing the wheel, because we've got a good strategic plan that just need to be updated with the realities of what we've been going through. And I think your input into the direction that the hospital is going to be taking is going to be critical to our decision-making going forward. So those two things, the financial management and the where we are in the strategic plan, have been the really highest priorities for us. And I also, before I ask Mike Seaman to talk about the Finance Committee, also want to recognize what has been an extraordinary effort in our HR area. So Joe, thank you and your staff for all of your hard work over these past couple of months to keep not only the culture going, but the potential disruptions to a minimum. And Karen and you and the nurses obviously as well have been just extraordinary. But that whole HR cultural piece has, as we have discussed around our board table for a long time, is really what defines the hospital. And the fact that we've been able to pay such close attention to it and come out of it, I think, perhaps even stronger, as the diversity event demonstrated, which parenthetically I might say to you is could have been one of my most proud moments in association with the hospital for having that happen. So Joe and Karen, Dr. Murray, thank you for all of that. Finance, Mike Seaman.
Yeah, I think Tom and John covered it pretty thorough in regards to that, and also as well as I said last month, great job on continuing looking at resources that we're entitled to, and managing that, and keeping the board informed of opportunities where we can recoup some additional dollars to help close this number that we're at. So again, congratulations for everything they're doing, and I understand that it's different and it's a different challenge, but like John always said, we got the best team in the country, so I believe we'll get through this better than we are today.
Thank you, Michael. Any questions for Mike and Finance Committee? Investments, Gino? How's the market doing today, Gino? Other than Zoom.
Yeah. Well, that's a very, very interesting question as we move forward. Well, we talked about getting a new account manager to work on the portfolio. I'll let John talk about that because it's a little intricate for me to describe. So John, you want to talk about a little bit about that? What we talked about the account manager?
Sure. Really a couple things have happened, but at the last meeting, the investment committee approved to move forward within policy ranges, but just within a different fixed income manager, by the name of Loomis Sales, who has significant experience in this area, both in length and in specificity around what we are looking for. But essentially, we've just taken, and the investment committee had approved a plan to take from some existing pieces within equity and then fixed income, just to really push our numbers towards our policy ranges within our asset allocation.
I think I understand what you just said.
That's why he had to say it instead of me.
I have no idea what you just said.
Yeah, and whatever, I agree. Whatever John said is right.
It's our shift to lower risk but better performance. How's that?
Okay, I understand that part. Anybody else have any questions for John or Mike or Gino? I'm sorry. Gino, that was a wise handoff, by the way.
You like that, huh?
That was good. That was good. Anyway, Michael Hufford.
Thank you, John.
Thanks, guys. QI, patient safety, Mike Hofford.
John, is what was sent out in the minutes, I think covers it, unless anybody has any specific questions. Or Dr. Murray, would you like to comment?
You're on mute.
All right, I got to unmute myself. Yeah, there were a couple of presentations this month. The dialysis unit presented, and I'm glad to report that they continue to achieve excellent quality metrics, particularly with regard to infections. We had a presentation from Dr. Shevley about their efforts to increase PSA screening in the primary care clinics. The neurology department, as well as trying to achieve the best metrics for stroke care, also has a project with folate supplementation in women with epilepsy of childbearing age to decrease the incidence of that. And the final presentation was organ donation, where we continue to achieve excellent rates. Actually, we've had 7 donors this year, despite 7 harvests this year, despite the COVID epidemic. So those were the major things this month.
Thank you, Dr. Murray. One question for you, Dr. Murray. The learnings that we've gained from the COVID response from a patient safety perspective, do you see many of those going forward beyond that which the COVID will require us to have?
Yes, John, certainly our approach to, I think one of the things that the pandemic has emphasized is the importance of some very basic infection control measures, even things such as hand hygiene, which we are achieving very high levels now in the hospital. I think it really reinforces the importance of a lot of those things. We've also learned a lot about how to manage these patients, from our initial experience. And we've, and probably Charlene would be the best person to talk about this, but we've already had a hot wash looking at at our plan, what aspects of our initial emergency plan worked, which ones, in retrospect, we want to revise. And in fact, because it's required by the state, we are working on a new emergency plan in case there is a resurgence in the fall.
Charlene, comments?
Yeah, like Dr. Murray said, we've already looked at, we had the kind of a interim hot wash, which is where we looked at what we've done over the last 3 months. And with that, we've identified some best practices. As we've shared these with the community, and we've shared it with other partners across New York State. Other people are adapting some of the things that we have learned. also they've shared with us ideas for what we can do improvement-wise going forward. So I think, we're really looking at the rest of June and July is planning for the fall for the next round, or as I say, we're in a little lull here right now with our numbers being lower, but we will be prepared for what will come in the fall, and I think in a stronger focus than what we even had. The emerging infections plan we've had since 2005, but we've done a lot of changes to it. And I think that we will be in a good place. And our goal, of course, will be to try to keep everything running and caring for COVID patients at the same time so that we can keep everyone safe, but make sure the community's needs are being met.
Charlene, can you give us an example of one of those changes, what they might be?
Well, originally our plan had identified some surge spaces, and once we had to stop doing surgeries, we had a lot of different ways that we could use our staffing and use the existing rooms, use as many rooms as we could as private rooms. So that is something we've learned. One of the other things, and it's just a basic one, but it's really important for the patients, and Karen has been really leading this along with Joe. We're trying to look at, we're all wearing masks now, and the patients can't see our faces. So we're trying to get pictures so that we can show the patients what we look like so they know who they're talking to behind the mask. So things like that, one is really the staffing side of it. The other is just trying to make sure the patients are really being cared with through compassion and trying to let them see, this is what we look like behind here. We really are people. So, little things, but some of the things are much bigger.
Don, I'd just like to add to that and thank Dr. Murray for his very concise report. What we do at quality improvement, it's not just about reporting that we're doing what we're supposed to in regards to a number of set statistics, but we're always looking to better care for our patients, and I believe we do. I mean, we're constantly improving. And Shar, as you just outlined, I'm looking forward to going forward, but it is a lot of work, but it's a team effort as well. So just thanks to everyone and kudos.
Thank you both. Thanks, everybody. Mr. Colucci, I don't know that there is anything that requires us to go into executive session, or Tom?
Nope.
Nothing on my agenda.
Okay. Is there anything else that we need to talk about, either old or new business?
John, where are we on the search for Terrace View?
This is Andy. I had reported earlier, but we've got a number of candidates that we started to interview. Pam Lee is leading that search, and we will narrow that search down to 3 here very shortly. And seems like we've had a good run of a number of candidates, so I don't think we should be able to name a replacement here very soon, but we will narrow that down to 3 within about a week or 2, and then have ongoing interviews. So we anticipate probably end of July to make an announcement.
You good with that, Bishop?
Yeah, that's fine.
Any other questions before we move to adjourn? Thank you all very much. I would suggest to you that although you will not pay for it, that you all have a drink, either alcoholic or not, in Andy's honor. And happy birthday again. And there being no further business, we are adjourned. Thank you, everybody. Please look for this planning information.
Hey, thanks.
We'll see you next month.
John.
Thank you.
Thank you, everybody.
Andy.
Happy birthday, Andy.
Take care. Thank you.
Happy birthday, Andy.
Appreciate you.
Goodbye, everybody.